May dala ako.
Hello, everyone. Welcome to LAMP Basics, the LAMP TCM and Acupuncture for beginners. Let's start the day with the first presentation. Let's welcome Ma'am Needs You, Certified Acupuncturist of Silang, Cavite. Good afternoon, Ma'am Needs.
Good afternoon, Doc Hector, and good afternoon, everyone. So we'll continue our topic, diagnosis by palpation. Okay. Point palpation. The main points of point palpation is checking for tenderness. So when it's very tender on superficial pressure yung sa ibabaw, it is sign of full condition on that channel or local stagnation. Okay. If there is pressure, nare-relieve ng ang pain, that is empty condition on that channel. And if the pressure relieves but then causes discomfort, it is mixed deficiency and excess condition. Okay, remember po. So all acupuncture points and ashi points can be used depending on the diagnosis. Okay, so main points for palpation diagnosis. Number one, front collecting mu points sa harap, back transporting shoe points sa likod, lower C points, source or the U1 points, and the ashi points. Okay? Let's go to front mu points. Mu means raise, collect, and enlist and recruit. Okay? It is the points where the chi of the relevant organs get collected. So, andyan po yung drawing. Then, bakshu points. It is where the points are located on the bladder channels. It reflects specifically the condition of the relevant internal organ instead of its channel. So, every point mayroon pong internal organ. Ha? Bladder 13, like for example, is for the lungs, bladder 15, for the heart, bladder 17, bladder 18, bladder 19. Yan po, may mga iba-ibang organs na naka-infuse dyan sa ating back. Okay? Then the lower C points, it is the points. Points are used to treat the respective young organs. Okay, there is a column here, the organ, then the point, and then the channel, and then the organ and the point. So in the organ of large intestine, the point is stomach 37, the channel is the yang ming, the organ is stomach, and the point is stomach 36. Okay, Sanjiao, point is UB39, the channel is Xiaoyang, the organ is gallbladder, and the point is UB34. Okay, stomach, small intestine, stomach 39 ang point, channel is Taiyang, the organ is urinary bladder, and the point is UB40. Okay? U1 points, may kasabihan dito, if the 5 yin organs are diseased, abnormal reactions will appear at the 12 source points. If we know the correspondence of source points to the relevant yin organ, we can diagnose when a yin organ is diseased. Spiritual Axis Chapter 1. Okay? So, U1 points, ito yung source points for the yin organs. Column ng yin organ and then the other source point. Yin organ, lungs, lung 9 ang source point. Heart, pericardium 7. Spleen, spleen 3. Liver, liver 3. And the kidneys, kidney 3. Okay. The ashi points, ashi theory. If there is soreness on pressure, whether on a channel or not, there is a point. So, yun yung ashi point, yung local points yan. Body is completely covered by different channels, so every area is irrigated by them. Pressure and description of the condition will reflect the channel which it is closest to, ashi points. Okay po. That's all for today. Thank you.
Thank you very much, Ma'am Needs. Let's welcome Ma'am Teresita Sumile for topic number 2, wood element, the concept. Good afternoon, Ma'am Teresita.
Good afternoon po, Doc Heck and classmates. Liver nourishes and controls tendons. Tendons are important for the mobility of our joints, and their suppleness depends on liver yin. And liver yang gives them firmness. In acute tendonitis, where there is inflammation, liver yang is in excess. If the inflammation lasts a long time or is recurrent, yin gets consumed. This makes the tendon hard, contracted, and shortened. The extension movement of the joint becomes limited. The tendons can rupture easily, and healing will be retarded. In chronic overuse, the tendons are already deficient in yin. Heat is generated when the joint is used, and more heat than usual will be generated because of yin deficiency, as it cannot control the yang efficiently. This is why the patients suffer recurrent inflammation and repetitive stress pain in tendons and joints. Joints tend to become stiff and creaky in the yin deficiency. Just like a door that creaks needs to be oiled, a creaky joint also needs lubrication, and fish oils are very good in this purpose. In fact, raw oils, as used in salads or in marinades, and butter or cream in moderation can be used as well. In liver yang deficiency or yin and yang deficiency, the tendons tend to become soft and weak. They do not provide stability to the joints, resulting in hypermobility. This can lead to joint pains and sprains accordingly easily. Clinical examples: contracture of tendon, problems with extension of joints. Dupuytren's syndrome. Notice of hardening the tendon on palm and contracture of ring finger. Okay, next po. Then Achilles tendons. Notice the hardening of the Achilles tendon and raised appearance of the heel. Then arthritis. Okay po. Contractions are caused by notice deviation of fingers and wrist and contracture of the biceps tendon in hemiplegia. Contractions are caused by liver yin deficiency, and liver yang has a tendency to rise during activity. Weakness of tendons and muscles. So weakness on osteoarthritis of knee. Next po. Bone is on in osteoarthritis. So, yun to. Next. Flat feet. Flat feet are caused by weakness of the kidney region at the arch of foot, causing many pain problems on the foot and postural problems along the inner leg. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Let's welcome Ma'am Lynn Galarita of Quezon City for wood element diseases. Good afternoon, Ma'am Lynn.
Good afternoon, Dr. Hector. Good afternoon, everyone. For today, we have another clinical example of a patient suffering from headache. This time, we have a female patient, 37 years old, who was a conference manager and had a very busy and demanding job at a large conference center. It required her to travel, to walk, and to be on her feet all day long, sometimes for more than 14 days at a stretch. Since about the same time of starting this job, she had had headache every month, which always came on the first day of her period and lasted for 2 to 3 days. The first day was her worst. She had to take medication and retire to her bed no matter where she was. The second and third days could be sometimes slightly better, but she still had to stay in bed. After the headache had gone, she would feel drained and weak for another few days. This did not suit her demanding job. She described the headaches as starting exactly on point bladder 2. This is near the medial end of the upper eyebrow. The right side worse than the left in traveling over the head to the occiput. On examinations of points bladder 10 and GB14 were tender to pressure. The pain was of a pulsating nature, and she reacted to sound more than light during the headache. There was no nausea, only a feeling of apathy and general malaise. Her doctor had suggested contraceptives, but she did not want to take this. Okay. For the doctor, this was clearly a urinary bladder young excess headache, young excess headache, because it manifested on the meridian and it appeared on the days of menstrual bleeding. The uterus in a woman is an organ that is directly associated with the urinary bladder meridian. We all know that giving moxibustion to point UB67, the tonification point of the urinary bladder, helps to reduce a malposition of the fetus in pregnancy. This is made possible by causing small contractions in the uterus and then turn the baby around. This same point is used with a needle during childbirth to strengthen the uterine contractions. At the same time, sedation of point bladder 65 will reduce uterine contractions. So the urinary bladder meridian is directly associated with the uterus. In men, the prostate gland has a direct association with the urinary bladder meridian. Okay. In the patient here, the headache manifested on the first day of her period, the day of the maximum bleeding for this patient. This was the time the activity and yang in the urinary bladder was highest in the month. The pain was yang in nature as it was pulsating pain, and the patient was hypersensitive to sound, as the ear is associated with kidney and the urinary bladder. The doctor decided that her urinary bladder yang must increase every month on the day of her period, and thus producing a yang dominant headache. For the yang to increase each month, it also means that the yin is weak, so it cannot control the yang. So if yin could be tonified between the headaches, this would prevent yang increasing. So as for the treatment given, first, the doctor used the local points, bladder 2 and GB14 and UB10 on both sides. And the distal point, LI4. This is the area distal point for head and face. A symptomatic point for headache, which is GB20. And also the influential point lung 9 for the pulsating pain. The doctor also uses energy balancing points, which is kidney 4, the Lu connecting point of the kidney, which tonifies yin and sedates the yang. And this would be excellent in preventing the increase of urinary bladder yang. UB64 is also selected as for sedation. This was only given if the treatment occurred on the days close to her period. And finally, REN3, which is the Mu front point of the urinary bladder. This cools and calms the organ. The patient was treated once weekly for 3 months. She did not have any headaches from the time the treatment started, even though she sometimes felt as if she might get one. She could not come every week for treatment as she was sometimes out of town. Now, 3 years since her first course, she still comes to the doctor 3 to 4 times a year just to make sure that she will not have the headaches again. Her periods are still regular. Okay? This is all for now. Thank you for listening.
Maraming ganyan, di ba? There are so many cases. That's
Yes.
very, very common, especially for women who live in tropical countries like the Philippines.
Dami na tayong matututunan dito.
Yeah. So let's call once again Ma'am Teresita Sumile for the metal element. Good afternoon ulit, Ma'am Teresita.
Good afternoon po ulit, classmates, and good afternoon ulit, Dr. Hector. Metal element, the concept, day 11 na po tayo. Associated emotion of metal element is grief. If yin and yang are two aspects of our lives, then sadness and joy are the two sides of the emotions. If one does not know sadness, how can one enjoy the happiness? Life begins with crying and ends with it too. An infant cries to communicate its needs. An adult cries to manipulate others, and no one likes to see another person crying. Sadness is very much part of our daily lives. We are sad for ourselves and for others. This sadness could become an interior pathogenic factor if we do not eliminate it. It can oppress the lungs, cause problems with breathing, and suppress the immune system, the way chi protecting energy. If we cry when we are sad, it feels like a big weight has been lifted from the chest, and we can breathe more easily after crying out our grief. Babies know how to cry at the time they are born, as they need this ability in order to breathe. But somewhere in the process of growing up, we lose this ability. Society does not tolerate crying in boys because it makes look them as silly as the girls. As soon enough, girls will not want to be thought as if silly as well. We all want to be clever people, not silly people. And so if we keep our emotions bottled up inside and all this harmful energy attacks our lungs and skin, resulting to causing asthma, eczema, cancer, and bowel problems, then so be it. Clinical example, we have a female 33 years old. This young woman, housewife and mother, came to the clinic with irritable bowel syndrome. As a problem affecting at least 30% of the patients in Britain, especially women, the symptoms are highly varied between patients. She had severe constipation, abdominal distension, and dull, constant abdominal pain all day. Even with laxatives, her stools were very lazy. Her clothes became tight around her waist during the afternoons, and she felt heavy, lethargic, and miserable. Her problem started 4 years ago after her mother's death, which had been quite sudden, and when the patient had been in the last month of her pregnancy. She had been the only child of her mother. Her father had died a few years back. The acupuncturist asked her if she had mourned her mother's death, had she cried at all. She did never cried since her mother died. She was angry, and her mother that her mother was not there for her child's birth. She had been depending on her mother helping her. Now she had to get on her own problems. She missed her mother very much and felt a tightness in her chest when she thought about her mother, but was unable to cry. Okay? So treatment on this condition, the points the acupuncturist gave this patient were Li4, which is the great eliminator, stomach 25, triple Werner 6, along with Li4. These points are symptomatic against symptoms. Constipation. UB13, Li11, the Bakshu point of the lung, and tonification point of Li for indirect tonification of lung function. Then paravertebral tapping with a plum blossom needle, at least at levels L2 to S4, until a red skin reaction is seen. The treatment was given daily until she had more than 2 bowel movements per day. Then the acupuncturist treated her twice weekly, then once a week, and gradually stopped treatment. She did not attend the treatment on the 4th day, but she came the next day and said to the acupuncturist, that she had cried all day, so much so that she thought something was wrong with her. She had to wait until her husband and daughter had left home, though. But now she felt so light and tranquil, like a little girl again. During later sessions, sometimes her little daughter accompanied her. Once she cried because she could not find her toy. The patient said to her, "It is okay, love. Just have a little cry and then you will get feel sad anymore." It was so refreshing on approach, when mostly what one hears is parents shushing their offspring. One who has a lung yin deficiency cannot feel sad. One with a lung yang deficiency cannot cry. One with lung yin excess feels always sad. One who has a yang excess in lung cries very easily. One who has lung yin and yang deficiency is sad and cries for no reason. Next is sadness increases lung yin. This is the reason for the feeling of tightness. If one feels sad, this increases fullness of the lungs. If one has lung yin excess, one feels unaccountably sad. An emotion could become a pathogenic factor, and an interior imbalance could manifest in an emotional state. One cannot live a life without feeling grief, but one should always be able to eliminate grief and continue with life free of baggage. The acupuncturists have witnessed many funerals in his village of Jaffna in Sri Lanka when she was a child. They used to be very noisy affairs, where each new person walking into the room would be greeted by a fresh rice in the wedding. Chests were beaten, songs were sung, men and women cried alike. Everyone sat around the dead and slept and awoke. When the funeral was over, life continued. The author said, "I had hated going to the funeral because of the drama and was pleasantly surprised when he went to a very civilized funeral in the West. The family members came to the funeral parlor for a very short burial ceremony. And then we all went to the family home for refreshments, conveyed our condolences to the immediate family members, and left. The Langchi helps us to eliminate sadness and to free the breathing. When we suppress our sadness, the Langchi is suppressed. Over a period of time, this can decrease the protecting energy or Wei Qi, which means we catch infections easily and you are vulnerable to cancer. We have an outer energy shield as an extension of our skin, which we refer to as the Wei Qi. This is the energy that helps us to reflect harmful energies away from the body surface and interior. If these harmful energies cannot be dispersed, they will stay in and infiltrate each and every organ, stagnating the energy flow, causing edema, tumors, retention, and other damp symptoms. As the dampness increases, it causes dirt and heat, just as varicose veins cause edema, and this can lead to varicose ulcer or eczema. The damp stagnation process goes gradually over a long period. Then the heat period started suddenly and worsens rapidly, which is rather typical of cancer. As therapists, at most times, we are physically strong and caring for the sick does not affect us personally. We feel strong and are glad to be in a position to help those unfortunate ill people. But there are times in our lives when we contract every infection that passes by. We feel that vulnerability. These are the times when our Wei Qi is weak. If we do not recognize this feeling, then we cannot do anything to strengthen our protecting energy shield. Point Li11, the tonification point of the large intestine, will also indirectly tonify the lung-yang aspect. This is the best point to improve the Wei Qi. Other points such as Gu14, the meeting point of the yang meridians, and points from spleen 6, the meeting point of the 3 yin meridians of the leg. The yang needs the yin to nourish, are good additional points. These points could be given as prophylaxis if a person feels vulnerable, or you could use them as treatment if a person already has an infection or fever. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We now proceed to topic number 5, blood. Let's call on Ma'am Lynn Galarita of Quezon City once again. Good afternoon, ulit, Ma'am Lynn.
Good afternoon ulit, Dr. Hector. Good afternoon, everyone. We're still on vital substances and the second installment on our topic about blood. Last time we had an overview of the different blood disharmonies. So for today, we'll start the discussion on Qi and blood relationships. Okay, Qi is yang and blood is yin. Qi is the commander of blood. Blood is the mother of Qi. So if the Qi is deficient, blood cannot move well. If there is not enough blood, then there will be a deficiency of Qi. So to explain further, blood nourishes Qi. In other words, Qi gives life and movement to blood. But blood nourishes the organs that produces Qi. Qi is yang compared to blood, which is yin in nature. Qi and blood are inseparable. So the key here is Qi is the commander of blood and blood is the mother of Qi. Okay. Still on the Qi and blood relationships. We have here the 4 aspects. First, chi generates blood. So from the good chi or the food chi, this forms the basis for blood. Chi moves blood. Chi is the motive force for blood. When chi moves, blood follows. And if chi stagnates, blood congeals. Okay? Chi holds blood. Chi holds blood in the vessels, preventing hemorrhage, especially the spleen chi. Okay. The 4th relationship, blood nourishes chi. As chi needs the nourishing qualities of blood, this provide a dense material, preventing chi from floating. Okay. So in general, we have here the basic formation of blood. We have discussed this previously, so this is a review. There are 2 separate cycles of blood formation in the body. The post-heaven chi cycle uses foods and fluids, which forms the good chi, to form blood. And the pre-heaven cycle uses the yuan chi and the kidneys to produce marrow, which produce blood. The blood is then circulated by the heart and stored by the liver. Okay. Here is the map or the flow diagram of the creation of blood. So as mentioned earlier, there are 2 sources of blood, the post-heaven source, which is from the food and liquid that we take, digested by the stomach, where the spleen acts on it and forms the guqi, and thereby creating blood. The second is the pre-heaven source of blood from the kidneys, which produces the marrow, and the yuan qi and the kidney acting on the marrow, and as then producing blood. The blood produced is then circulated by the heart and stored by the liver. Okay. Next. As for the functions of blood in the body, 1, it moistens and provides nourishment to organs, bones, muscles, tendons, and skin. Second, with chi, it provides the foundation for mental activity. So, mapapansin natin yan sa mga disharmonies kung ano, if there is problem with the blood. In summary, there are 3 blood disharmonies patterns. Here are the following blood disharmonies and their symptoms. The first pattern is heart, liver, and or spleen blood deficiency. This will manifest with fatigue, palpitations, numbness, dizziness, blurred vision. The tongue will be pale with coat, and the pulse will be thin. The second pattern of disharmony is liver, large intestines, and stomach blood stagnation. This will manifest with pain fixed in location, dull complexion, and PTK. There will be purple and or purple spots in the tongue, and there will be a deep, choppy, or maybe a little wiry pulse. The third disharmony is heat in the blood. As for the signs, there is reckless bleeding or hemorrhage between cycles. There's restlessness and irritability. So the tongue will be deep, red, and the pulse will be rapid. Okay? Thank you for listening.
Thank you very much, Ma'am Lynn. Let's now discuss the water element, still on the concept. This time we talk about impotence and premature ejaculation. Okay, so we will be focusing we have learned that for women, the normal menstrual cycle should be within the range of 27 and 32 days. And here you could see the yang and yin components, okay? At the same time, you can also see the two phases of the menstrual cycle. So we have the heat phase followed by the damp heat phase. So you have the different characteristics of the phases as you can see from the figure. So it is clear that in the first half of the cycle, a woman loses a lot of blood and fluid. So after that, she is going to be dry. She's rather dry. Then her body temperature begins to rise because there is depletion of yin, and the blood and yin in her reproductive organs also increase, but this time at a slower pace. Okay, because of the rise in temperature, there is always an attempt of the yin to go up. Okay, if you remember the rules. So this time, the body will have to make use of the blood and yin in the reproductive organs, but this time at a much slower pace. So at the sharpest rise of body temperature, ovulation will occur. In Tagalog, nangingitlog, no? Nag-ovulate. From then on, the emphasis is on the endometrium. So this thickens with the blood vessels and blood circulation, and this will have to secrete mucus to help the fertilized ovum to travel. Okay, so the secretion of mucus by the endometrium will facilitate the travel of the fertilized ovum. And this will also provide the damp, nutritious place for the ovum to embed itself. The increased blood circulation and dampness of the second part of the cycle will also help to maintain and even increase some warmth in the body, because as the yin fuels the yang. But if this yin and blood does not continue to flourish, it would be impossible for the woman to remain healthily pregnant. So the heat is maintained by the blood and yin, and together they nurture the pregnancy. Just as fire needs fuel to burn, if the blood and yin reduce, the fire of the kidneys will diminish too. So let's talk about impotence. Erection requires heat and libido, and this is a kidney yang aspect. If the kidney yang becomes deficient, the reproductive system loses desire, ability, and force. So when kidney yin is decreased, it loses endurance, stability, and life essence. As man is yang dominant, early aging, in this case, often begins with a deficiency of yin and will manifest as loss of head, hair, backache, high blood pressure, and stress. Impotence at this age is also due to kidney yin deficiency. These men are also easily exhausted, irritable, sleepless, and are poorly and have many work. The sleep is very poor, so they sleep less and they have poor sleep and they have many work-related worries. The older man has more time, is more settled at work and home, but he has lost yin, yang, blood, and qi during his life and has problems achieving and maintaining an erection. The fact that his partner would be trying to cope with her menopause does not help either. All in all, tonifying the yin and yang of the kidneys is very helpful in the treatment of impotence. But it is also important to make time for rest and play. It is easier to hold on to one's youth, but once you lose it, it's not so easy to win it back. Okay. So kidney essence is difficult. Kaya nga, dapat as early as now, you should endeavor to look young. Okay. There is no point of trying to look young if you're already look old. So kidney essence is difficult to build up again, but easier to retain. patients often seem to believe that every part of the body should function at our will, no matter how we feel emotionally or how we abuse our energy. Impotence could be also an early signal for diseases like diabetes or hypertension, and relevant investigations may be helpful. Now let's go to premature ejaculation. This is a condition of leakage from the kidneys. So there is yin-yang and qi deficiency, where the kidney cannot control the point of release. So again, it is quite successful to treat premature ejaculation. When we treat any deficiency of the reproductive system, we have to use tonification points, and if necessary, the mother organ needs to be tonified too. So the mother element of the reproductive kidney and urinary bladder is earth. When tonifying the kidney yang, then we need to tonify the stomach, which is a yang organ. When tonifying the kidney yin, we tonify the yin organ, the spleen. It is also necessary to use diet, color, and environmental energies to help to improve the energy and consolidate the effect of tonification. Treatment for impotence and infertility. So what are the points for both yin and yang tonification of the kidney? We have REN 3, we have 2 needle and moxa, and stomach 29. So these are the local points. Then we also use an area distal point, which is spleen 6, and kidney 3, which is the earth point, which tonifies the yang, will be alternated with kidney 7, which is also a tonification point. Bladder 23, bladder 28, the back shoe points tonify the kidney, the urinary bladder yang. Bladder 67, moxa, tonification point, tonifies the yang. Stomach 36, the earth point or the house element point, tonifies the yang of the mother organ. So treatment sessions for premature ejaculation, minimum of 3 times a week, or 4 times a weekly would be, so 4 times a week would be ideal, 10 sessions per course. So there will be a rest of 3 months. Okay, so the course can be repeated after 3 months. Warm and cooked food, including the feet of animals like chicken legs, pig trotters, and fish, all kinds, especially small fish with bones, because there's a lot of movement there. There's a lot of yang, and keeping the lower part of the body warm will help. Stagnation of dampness in the reproductive system leads to tendency towards tumors and hypertrophy. Ovarian tumor, fibromyoma of the uterus, hypertrophy of the prostate are examples. Ovarian tumor is associated with the kidney, and both uterine fibroids and hypertrophy of the prostate are associated with the urinary bladder. The dampness generated by the spleen attacks and stagnates at the reproductive organs because they have a functional or qi deficiency. It therefore becomes necessary to treat both elements. Okay, so we treat both the earth, and the spleen damp. So here you could see the spleen dampness, then the kidney and the urinary bladder. So as much as possible, we need to tonify our spleen. And I think the reason why we see a rise in cases of ovarian tumor and uterine fibroids plus prostatic hypertrophy is because many people are, or many men and women are ignorant about dampness in their tongues. Okay, so let's start educating people about the importance of actually looking at our tongues. Okay. Let's talk about ovarian cysts. When not too large, they're very effective to treat. The size of the ovarian cyst tends to vary during different periods of the menstrual cycle. So these are also sensitive to treatment, and they respond quickly and favorably. So if you have small cysts, too small to be felt by abdominal palpation, you only moxa REN 3. So very simple. For large cysts means there is a discernible lump on abdominal palpation. So we do electrostimulation. So the diagram will show us how two needles are connected to one outlet of the electrical stimulator. So these two needles should be along one meridian. So in this case, the stomach meridian. If the cyst is larger, there can be two more needles on the spleen meridian. So this is another meridian. They are stimulated continuously at 10 hertz for 20 minutes. So bladder 28 with the first needle and then joy cupping. Bladder 23, back shoe points of the urinary bladder kidney. So spleen 6, area distal point. Bladder 58, lugo point to sedate the yin and tonify the yang in the kidney and urinary bladder. And stomach 40, lugo point to circulate dampness in the spleen. The ear, we have the ovaries. This is for ear acupuncture. You needle the ovaries, the triple warmer to circulate the dampness, the kidney, and the spleen. 2 sessions a week for 14 sessions make up a course. Improvement continues after the treatment is stopped. Another course may be given 2 to 3 months later if necessary. Now let's talk about uterine fibroids and prostate hypertrophy. So treatment is similar as the imbalance is the same and the local area is similar. So we could see from here that the prostate hypertrophy is the counterpart, the male counterpart of the uterine fibroids in women. Some points can be added or removed according to special symptoms like excessive uterine bleeding. So rentary moxa, the front mu point of the bladder, mild moxa for 2 to 3 minutes, stop before the skin changes to red color. Stomach 29, local point. Bladder 23 and 28, the back shoe points of the kidney and urinary bladder. Back 28 with needle, then dry cupping. And then we use spleen 6, the area distal point. The luo point, bladder 58 to sedate the yin and tonify the yang. Stomach 40 to circulate the dampness, another luo point. Bladder 39, the lower C point of the triple warmer to circulate the dampness. And for ear acupuncture, we have uterus, urinary bladder, triple warmer, and the spleen. In case of uterine fibroids with excessive bleeding, there may be blood stagnation in the uterus, either with or without dam stagnation. So the following points can be added. Spleen 1, moxa only, because this is a very painful point. So this is a wood point and grandmother point, tonifies the yang and helps the spleen to hold the blood within vessels. And a luo point of the liver, which is liver 5, to tonify the liver yin and sedate the yang. The yin of the liver stores blood and yang releases it. So for hypertrophy of the prostate, or BPH, we call it, benign prostatic hypertrophy with urinary problems. These are mainly slow urination with the rest remaining in the bladder and increased nocturnal urination. So points, aside from the ones mentioned above, kidney 3, which is an earth point to tonify the yang, paravertebral tapping of the sacrum in the direction from lumbar 4 towards sacrum 4, about 1 cm lateral to the center until a red skin reaction is seen. And advice against drinking beer, coffee, or tea in the evenings. So pwede pala sa umaga. Okay. So thank you very much for your attention. We now proceed to Meridian theory, and let's call once again Ma'am Lynn Galarita of Quezon City. Good afternoon, Ma'am Lynn ulit.
Good afternoon ulit. So we're still on the extra meridians. Last time we discussed about the du meridian. For today, we'll tackle the Ren meridian. Okay. The Ren meridian is also called the conception meridian or the conception vessel. Its confluent point is lung 7. The Ren meridian is the front, midline, and the most yin meridians of the body, and it circulates the yin energy for all the body. It can be used to tonify or sedate the general yin, where there is yin deficiency or excess in the three elements or more. Simultaneous yin deficiency in kidney, liver, and heart is very common, but it would be too much to tonify these organs individually. An efficient way to achieve this is by tonifying the REN channel. Of course, the patient would have to drink more water and eat some salty food to help store more water in the body and avoid heat-producing food. When tonifying the REN meridian, the confluent point lung 7, which is middled with the flow of the lung meridian, and the 3 points on the meridian should be used so that a clear message is given to the body that it is the REN meridian and not the lung meridian that we need to tonify. Ideally, points on the upper, middle, and lower warmer must be used, such as REN 3 for the lower warmer, REN 12 for the middle warmer, and REN 7 for the upper warmer. Okay. In the West, many middle-aged women seem to suffer from general dryness and ascending heat symptoms. To tonify REN meridian would be very good for their energy state. But many of these women have a scar blocking the REN meridian from either a cesarean section or hysterectomy. In men, this happens to be a heat bypass scar, a heart bypass scar. If the REN meridian is interrupted, the yin can't rise to the upper part of the body. If the kidney meridian, which flows at close proximity to the REN, is also blocked, this means no yin energy comes to the upper body to control the heat. So when treating these patients, it is important to unblock both the REN and the kidney meridians. It is very rare that we will find a yin excess in 3 elements. But in case we wish to sedate the REN meridian, it would be sufficient to sedate point lung 7 by needling it against the direction of the meridian. The REN and Du meridians are coupled with each other to balance the general yin and yang energies of the body. They have Lu collaterals that flow between them and connect them. They have Lu connecting points that receive energy from each other and convert it to their own energy. But unlike the other 12 meridians, they do not have the yuan source points. Okay. When would the interrelationship between the REN and Du meridians be used? For the doctor, if there was a major imbalance in the yin and yang energies of the body, he would consider to use the Lu connecting points. For instance, if there was a yin deficiency in the 3 elements and yang excess in 3 elements, this would be a good indication for using the point of REN 15, the Lu connecting point of the REN vessel, to send the excess yang into and convert it into the deficient yin. Point Du 1 can be used if there was a yin excess in the 3 elements and yang deficiency in the 3. Okay. So let's start locating the points along the REN meridian. So we'll start with REN 3. REN 3 is located on the anterior midline, 1 tune superior to the upper border of the pubic symphysis, or 4 tune inferior to the umbilicus. This is the front viewpoint of the urinary bladder. It can cool and calm the organ, especially useful in irritable bladder or prostatitis symptoms. It is also a local point for the bladder, uterus, and prostate gland. Moxa on this point is used in infertility and erectile dysfunction. Next point is REN 4. It is located on the anterior midline, 2 tune superior to the upper border of the pubic symphysis, or 3 tune inferior to the umbilicus. This is the move front point of the small intestine, an excellent point in the small intestine colic and diarrhea. It can be warmed with moxa against malabsorption diarrhea. So next up is REN5. It is on the anterior midline, 2 tuned to the umbilicus or 3 tuned superior to the upper border of the pubic symphysis. It is the new front point of the triple warmer. This point along with REN9 is applied with needle and cupping against ascites and lymphedema. Next point is REN6. It is located on the anterior midline, 1.5 tune inferior to the umbilicus or 3.5 tune superior to the upper border of the pubic symphysis. This is the point of C energy and is used to improve energy levels, especially when patients are fatigued and low in energy. Okay. Here we have a picture where REN3 is located. It is 4 tune below the umbilicus. REN4 is 3 tune below the umbilicus, and REN2 is 2 tune below REN4. Okay. REN5 or CV5, the Shemen, is 2 tune below the umbilicus. Okay. And we have discussed REN6 earlier, and then this is REN2. Okay. So join us again next time as we continue our discussion on the REN region. Thank you for listening.
Thank you very much, Ma'am Lynn. We now come to the last topic for this afternoon. Let's welcome once again Ma'am Needs You, certified acupuncturist of Silang, Cavite. Good afternoon ulit, Ma'am Needs.
Good afternoon po, Doc Hector, and good afternoon, classmates. So here is the continuation of chronic fatigue syndrome, yin fire. Okay. So the pathology of yin fire is further complicated by dampness and by a pathology of the middle burner as well. When the spleen is deficient, dampness is formed, and this infuses down to the lower burner. Here it swamps the original chi in the minister fire, displacing the latter from the place, the lower burner, where it should be concealed. So that's in the figure. Okay. So here, the yin fire pathology with dampness, emotional stress steers minister fire out of its concealment place. So minister fire harasses the heart and the pericardium. The symptoms is depression. The symptoms you could see is depression, feeling of heat in the face and red cheeks. So deficiency of the stomach and spleen leads to dampness. Chi infuses down and where dampness is formed, and then dampness obstructs into the yuan chi, and there is deficiency where you can have the symptom of exhaustion and feeling cold. Okay? So let's go to the next. Any emotion can lead to yin fire, as all emotions may steer the minister fire out of its residing place in the lower dantian, the chan. Okay? All emotions lead to chi stagnation, which in turn eventually leads to some heat. The situation can be aggravated by the presence of dampness in the lower burner, as we see, uh, a little while, as it happens in shame. Yin fire accounts for symptoms of heat in mental, emotional problems that may defy a classification into full or empty heat. This happens when there are symptoms of heat above, yun yung red face, thirst, feeling of heat in the face, and cold below, yung sa paa, cold feet, general cold feeling, and such situation is due to yin fire, okay? Emotional stress is more likely to lead to yin fire when it is combined with overwork and dietary irregularity. So you have to check your diet and overwork, okay? Regular diet, okay? So here, this is the clinical manifestation of yin fire. Above, you can have the symptoms, low-grade fever, dizziness, pale tongue and weak pulse, weak voice, shortness of breath, spontaneous sweating, and the feeling of heat in the face, red face, mouth ulcers. So below, there is a cold feet and the muscle weakness, loose loose tools and exhaustion, feeling cold in general sa paa. Okay. Yun po yung clinical manifestation of fire. Thank you po, everyone.
Maraming salamat po, Ma'am Nitz. And thank you everyone for joining. We hope that you could join us again next time. Thank you, everyone.